My talk today would be mostly about prevention of dental disease. In these times, we want to avoid, going out as much as possible. Dentists have been advised not to practice dentistry for obvious reasons. Prevention in dentistry starts at home. In dentistry, your prevention starts with your toothbrushing techniques. And what I'd like to first address is why this is important. Dr. Imran did allude to it a little bit. I wanted to go into a little more detail about why your dental health is extremely important. In short, your dental health is related to your overall health. The bacteria in your mouth are directly responsible for your cardiac health, as has been proved, and vice versa. Where if we see a patient who's had severe high blood pressure, hypertension, any kind of cardiac disease, and has gingival disease or periodontal disease, it does get their heart ailment is exacerbated. Same with diabetes. If you have a diabetic who has severe gum disease, it's going to be difficult to control the diabetes until their gum disease is under control. We have also noticed in pregnant ladies where if their oral health is not hygienic, or if they haven't had good periodontal health or gum health, then the chances of a late-term miscarriage is quite common. This and of course, Dr. Imran did tell us about the correlation between your dental health and the gut biome. So given all this, we know now how critical it is to take care of your teeth. And that being said, let's talk about what it is we can do to prevent gum disease and caries or cavities. One of the first things that we can do is our home care. Our home care should involve good toothbrushing techniques. One of the things I absolutely recommend a person do is throw out your manual toothbrushes and get your electric toothbrushes. This is the single most important change you can make today in your daily care for your teeth. An electric toothbrush does clean your teeth about 10 times more. It does remove plaque about 10 times more than a manual toothbrush. There are various toothbrushes out there. Take your pick. There are some that have sounds and lights and all sorts of things, but you can go for the basic one. But that's my recommendation, an electric toothbrush for sure. Toothpaste, which has fluoride in it, if you have children above the age of 3. Below the age of 3, fluoride is not recommended. So every other person should be using a toothpaste with fluoride unless otherwise recommended. And so that's with your toothpaste. And then in addition to that, I would recommend cleaning your tongue with a stainless steel tongue cleaner. Now the last thing, which most of us hate to do, is the dental floss. And why is that important? If you've noticed, our teeth are extremely closely spaced together. Our toothbrush just simply cannot reach between teeth. So if you're doing everything I just mentioned and doing it twice a day as you're supposed to do, you're still not doing 100% of the job. You're barely doing 80% of the job. So you do need to floss between your teeth to remove all the food particles and plaque that's collected in between your teeth. Now, as far as prevention is concerned, one other missing element is also visiting your dentist twice a year to get your teeth checked and get your teeth cleaned and make sure that you're free of disease. And if you're not, then to follow the recommendations provided. Very often in my office, when we give options to patients for treatment, a lot of patients do opt for the easier treatment, which is an extraction of a tooth. And I believe the thought process behind it is, oh, I have 32 of them. It's okay to lose one. I'm not going to be losing too much function. And they're not wrong in thinking that. What we are wrong in thinking is that those 32 are not linked to each other. Losing one, you are going to have a domino effect on the rest of your teeth. So as far as possible, please follow your dentist instructions, no matter what, to try and save your tooth as much as possible. And if it's simply not possible, then go ahead and follow recommendations to replace the tooth after the extraction. I think for today, I think this is what we have. And a friend made an interesting observation with COVID, that given these times, you want to visit your dentist less. So prevention is obviously the key. However, dentists are doing tele-dentistry. So if you're in pain, please do contact your dentist or the American Dental Association, and they will forward you to somebody who can prescribe or help you out temporarily, at least.